What is up, guys? Today I want to talk about my one of my rotations I just finished, which was in the home health setting, and pretty much just want to talk about either if you're a student or somebody that doesn't know what home health is. Pretty much just talk about my experience really briefly and give some advantages and disadvantages to the setting that I saw. Just finishing up the rotation. So for those of you that don't even know what home health is a super unique setting that I was fortunate enough to do for one of my rotations. And pretty much it's going to people's houses and doing physical therapy there. These are patients that are homebound that either just came out of the hospital or are just homebound for whatever reason. And your job is to pretty much make them not homebound so that they can get around the house and do stuff independently. Also just leave the house and not be stuck in their home. So the advantages that I saw in home health that I really liked is, first off, it's one-on-one care. You're going by yourself, seeing one patient instead of a busy outpatient clinic, seeing 1 million patients a day and a bunch of documentation. I think the max patients that I saw in a day was 8 maybe, and that was on a busy day. I had some days where I saw 2 patients. I had some days where I saw 1 patient. But on average, the average day for me was 6 patients. We would start at 9 a.m. and go till 2 or so. And that was our day. So the one-on-one aspect is really great. I guess you can say disadvantage, or a part that takes some time to get used to, is you are the only provider going to this house. So versus if you're in an outpatient setting or like a hospital where you have other people to rely on, home health, you're pretty much out there by yourself in the house with the patient. And not that you can't reach out to people through chat or whatever, but in person at the time, you're there by yourself, and you have to make sure that that you just make decisions that are rational. For example, checking vitals is super important every single time you see a patient, and there was a lot of times I was with my clinical instructor, and we would check vitals of a patient and they would not be appropriate to work with for that day, but it was up to me, and of course my instructor was there, but it was up to me to realize when a patient wasn't appropriate for physical therapy that day. And it's your job as a physical therapist going to the house, knowing when it's appropriate to do therapy and when it's not. And if it's not appropriate to do therapy, then knowing if you need to call their doctor or refer them if it's something serious. So that stuff takes a little time to get used to, and that can be, I guess, the scary part for a lot of people doing home health at first, especially as like a new grad, from what I've heard. Luckily I had my instructor right there, so if I was unsure of something I would ask him, but getting a job right after school, from what my instructor said, that's always one of the scarier parts for new grads coming out. And then unique experiences that I got to experience were, I got to be part of case conferences that was, I think, bi-weekly. So on a case conference, it was obviously through Zoom because of COVID, we couldn't meet in person. But you would go on and meet with the nurses, the OTs, the speech therapists, case managers, pretty much just talk about all the patients that are in your area and discuss them with other providers, things that you might have not known that the nurse might have caught. This is kind of the time to bring all the information in on all patients and see kind of what their discharge plan is going to look like in the coming weeks. And then the other unique experience that you get to kind of do is that kind of what I already mentioned, you're the first provider for a lot of these patients that they see. So a lot of these patients don't see their primary care physician. Some people don't have one at all, and you're the one that's going to catch a lot of stuff sometimes in a session or with their vitals or whatever. A lot of these patients have comorbidities. That's why it's super important to do the vitals, sometimes do checking lung sounds, heart sounds, depending on the patient. And yeah, it's your job to really catch some of that stuff. So it's, as scary as it can sound, it's also rewarding because you can kind of act as that almost that primary care physician. I mean, we're getting our doctorate for a reason, and you kind of get to put those skills to the test and be that person to make clinical decisions like that. So overall, I really liked my home health rotation. I think if you have the opportunity as a student to get a home health rotation, I strongly would suggest it. It's super unique. Not a lot of students get to do it. And even if you're not sure that you want to go into home health, like, at least give it a shot. It's a rotation for a reason, so you don't have to be obsessed with it after. If you find out you don't like it after your rotation, then there you go, you ruled something out. But I ended up really liking it. Thought it was super unique. I loved the one-on-one experience, and I just liked I like going to people's houses and you get to drive in your car between each patient, so you really get like a 10-minute break or however long your next drive is for the next patient. You kind of just sit in your car, listen to your music, and kind of like think about your next patient, whereas in like outpatient, you're just constantly running around usually. From patient to patient, you don't even get a minute to sometimes sit down. So in home health, after every hour, you're driving your car and you get some time to like think and dwell, which I really liked. So there's a lot of pros, in my opinion, to home health. Also, reimbursement's better for after graduation, so that's another thing to think about. But in terms of getting a rotation in home health, I strongly suggest it if you're a student. It's a great experience, and it's something that I feel like a lot of students don't get the chance to try, and I think more students should try it because it's a very unique rotation and it's super cool in my opinion. So that's pretty much it. If you have any other questions about home health or what a rotation's like in home health, feel free to comment below or message me. But yeah, besides that, I'll talk to you guys later.